And a community-based approach in Burao town, Somaliland, is helping to tackle the causes of malnutrition. NGO workers are teaching women how to breastfeed properly because it's one of the healthiest ways to feed babies. Women and children wait for their turn to see a doctor at this clinic in Burao town, located in Somaliland, Somali's breakaway territory. Most are here seeking treatment for malnutrition. Large numbers of children across Somalia continue to suffer from the condition. Consecutive droughts in Somaliland have seen malnutrition in the country continue to rise. Medare, a local charity, has partnered with UNICEF after a 2010-2011 drought to address the problem.
We have treated 90% of the children who was in the community and severely malnourished at that time. And we also give them an opportunity that they can help their other children at home to do prevention things. And with that sort of things has improved, and the number of children that was coming to us is reduced, and we continue mobilizing them, we continue reaching house by house, we continue teaching them.
Parents now have access to weekly supplies of the peanut-based therapeutic food, plumpy nut, as well as oral rehydration salts that help treat malnutrition. Najma Ahmed has brought her 9-month-old baby Najma to the clinic to collect this week's supply of plumpy nut.
The baby fell sick, and when I brought her to the health center, they put her under the therapeutic feeding program. She has improved a lot since she started eating the peanut paste.
Outside the clinic, Zainab Aden, a midwife, is holding a nutrition education session about infant and young child feeding. It is targeted to new mothers and pregnant women to teach them about preventing child malnutrition.
First, we tell the mothers to breastfeed their baby for the first 6 months and that they should not give the baby any other food. The second thing is how to hold the baby when breastfeeding. Thirdly, when the baby is over 6 months old, you should start feeding them on other foods and continue breastfeeding.
Community health workers are also sent out through the program to educate families on how to prevent and detect signs of malnutrition. Aisha Mohamed is the team leader of the community volunteer group. Today, she is visiting families at Kusar camp for the displaced in the outskirts of Burao.
Malnutrition is a result of two things, hunger and diseases. If it is by disease, we tell the mothers to take their children to the hospital, and if it is by hunger, we tell them to take their babies to the health center to get peanut paste.
Officials say the new approach has been successful. However, malnutrition remains a major threat in Burao and still needs monitoring. UNICEF says about 236,000 Somali children under the age of 5 were malnourished in September 2012. 2/3 of them live in the south, where conflict and restricted humanitarian access remain a problem.